Emergency 911, this line is being recorded.
For years, Manatee County has in many ways been the epicenter of Florida's heroin epidemic, tearing apart families like Gerrie Stanhope's.
I lost my son, I lost my grandson.
In just a year, she lost 4 family members to heroin.
I just wonder if it's touched my family so many times and so seriously. Look at all the others out there. I mean, it's affected a lot of people.
But it wasn't until this month that Governor Rick Scott declared a public health emergency following a series of community opioid workshops, one of which was held in Manatee County.
I kind of felt like, oh wow, somebody's listening for a change.
A recent report from the Florida Behavioral Health Association says opioids such as heroin lead to nearly 10 deaths a day in the state, killing someone every 2.5 hours. Manatee County tops the list with the highest number of overdose deaths per capita. The Manatee County Sheriff's Office made more than 1,000 drug-related arrests last year and confiscated nearly $2 million in narcotics. Meanwhile, in Tallahassee, lawmakers imposed stiffer penalties for possession of a synthetic form of the drug called fentanyl. Drug dealers whose customers overdose on the powerful painkiller will now be charged with murder. But the general consensus is to shift the focus from arrests to easily accessible treatment. And this public health emergency will do just that, directing $27 million in federal funding to the state for treatment. Already, Congressman Vern Buchanan has asked the governor to direct a large chunk of that funding to Sarasota and Manatee counties. The congressman has long been considered a champion in the local fight against the epidemic, and in past interviews told us it's a top priority.
It's become more available, it's cheaper, but it's also the most highly potent, addictive drug in the world, and it's become very scary for a lot of our folks in the community.
In Washington, though, Buchanan voted in favor of repealing Obamacare and replacing it with the Republican majority's American Health Care Act, a bill that, beginning in 2020, would do away with a requirement that Medicaid cover mental health and addiction services in states that expanded Medicaid, leaving it up to each state to decide. The concern is that option for states would allow them to choose not to cover the nearly 1.3 million Americans who rely on those services. Florida didn't expand Medicaid, so this would not have local impact. But it could have an impact in states like Ohio, Kentucky, and West Virginia that are also battling this epidemic. We reached out to Buchanan for an interview, but a spokesperson for the congressman told us he was spending time with his new granddaughter and was unavailable during the House's 11-day recess.
Vern Buchanan should be spending this congressional recess explaining to his constituents why he voted for the American Health Care Act.
Buchanan did explain in a statement, since Florida never expanded Medicaid, this will not be a factor as it will be in some other states. The bill does allot $100 billion through 2026 for states to offer financial assistance for high-risk patients, including those battling substance abuse. Melissa Larkin-Skinner of Centerstone Addiction Treatment says accessible care is crucial in the fight.
Regardless of what we do, prevention-wise or law enforcement-wise, we have to have an answer for these folks that are really struggling now.
The public health emergency funding will focus on treatment, specifically medication-assisted treatment. Larkin-Skinner says that's an important part of the fight, but says the most common request she gets is for inpatient care, a request that's hard to meet with few beds and growing demand.
It's all about them being separated from that drug that, we're afraid is going to kill them.
For families like Stanhope's, the clock is ticking while they wait for change.
I still have people in my family and real close friends of theirs that are still using, and I just wait for that phone call.